Hey everyone, my name is Arnold at EviSmart. Here I'm with the dentist legend, Dr. Rick Ferguson.
Hi Arnold.
Alright, so Dr. Rick Ferguson will do a walkthrough for soft Reline denture from PacDent.
So Arnold, my goal here is just to show you how quickly we can use the PacDent Soft Reline Kit to reline an immediate denture or a conventional denture. It can work with either 3D printed dentures or with conventional acrylic dentures as well. So the kit itself comes with everything you need to do the soft reline. It also comes with an instruction manual, and you can see there's a few steps, about 8 steps total. They're not as complicated as they look, and I'm just going to walk you through quickly everything in the kit and how we're going to use it to do the soft reline. So you have some polishing discs and some burrs here. You have applicators for the adhesive, and of course you have the soft reline material itself. And then you have some mixing tips as well. So the first thing you're going to want to do is get your tip and your soft reline material ready in your impression gun. So let's go ahead and take this off and put the new tip on. And you can see it has a flare tip which makes evenly distributing the material very easy. We're going to go ahead and load up our tip, our syringe, in our gun here. Now typically my assistant is doing this, but you can see that's all ready to go. So we're going to put that aside and we're going to look at the rest of the kit. We're going to take out one of these applicator brushes. This is for the adhesive. Have that ready to go. Okay. We'll just put that right there. And our polishing and finishing burrs, which we're going to look at as well in a minute. The only other thing you'll probably need is an acrylic burr to help adjust the denture if you need to. And here is our adhesive as well. So the first step is to take your acrylic burr and just roughen up the edges, smooth the edges here of the flange on the denture. We already did that, okay? Make sure, by the way, that the intaglio surface of the denture is rough, so you can use this brown polishing brush to do that. And then you're going to want to go ahead and air dry that, blow it off with compressed air so there's not a lot of particles here. And then we're going to use our adhesive to paint. You want to paint about 4 coats of this adhesive on the intaglio of the denture. So we're going to go ahead and paint one real quick, and then we'll let that quickly dry. So that just takes a few seconds to dry, and then you can use compressed air on that to dry it more quickly if you want. Then we're going to go ahead and paint a second coat. Go right up to the edges of the denture so the material sticks all the way up to the edges. And then again, let that dry. This is coat number 3. And then let that dry. Just a very thin coat each time. And then again, yep, it's almost dried there. And then coat number 4. And then we'll let that dry. Okay. So let's go ahead and close up our adhesive so we don't waste that. And pretty much everything is ready to go. We're now going to pretend as if we're seeding this in the patient's mouth. So we're going to gently coat the intaglio of the denture with the mixture. So we're going to express a little bit of material first to make sure that it's mixing properly. And then we're going to go ahead and gently coat the intaglio of the denture. Just an even coat all the way around. So try to keep it evenly distributed. Of course, once you put it in the patient's mouth, it's going to spread out. And then we're going to simulate here seeding the denture in the patient's mouth. So when you do this, what you want to do is have the patient bite gently into occlusion and hold that for about 4 minutes. You can, check the little bit that you expressed out before to make sure that it's set before you remove it. So we're going to wait for that to happen.
So what was your first thought when you tried Rodin soft Reline on a patient?
My first thought was, I don't know if this is going to work. I was never a fan of soft reline materials. Of course, we've been using the silicone types for a while. That's probably the one that I use the most. but also that didn't stick very well to the 3D printed dentures. But this certainly works a lot better than those, and we've been very happy with the results that we're getting from this product. Especially, when we do immediate dentures, do extractions and such, this works really well. And that's one of the indications, I think, the prime indications for using 3D printed dentures, because we can turn those around quickly, and they're low cost. We know the immediate denture is going to have to be replaced anyway, so anything we can do to lower that cost of that immediate denture before we go to a final denture later on after everything's healed.
Yeah. So you already pointed all about the things, but what's your most favorite thing about soft Reline from Pactent?
So I think it's the ease of use. You can see how quickly we're able to do that. And this is something that typically we're delegating to our assistants as well. It's easy to do. Everything comes also in one package, which makes it nice. We don't have to piecemeal everything. I mean, other than the acrylic fur for the adjustments, which most dentists typically have anyways, everything is in a simple, small package, which makes it very convenient.
Mm-hmm. And the third question is, from a clinician's standpoint, what makes Rodin soft Reline stand out during the soft Reline procedures compared to other chairside material?
So this material is very simple to use, and we've been using it now for over a year, and we've been very impressed with the results. A lot of the other chairside soft Reline materials, they deteriorate very quickly, and then the silicone ones tend to peel out after a while. This doesn't happen with this material. If you follow the instructions carefully, you'll see that it's long-lasting and it holds the bond to the denture for a long time.
Yeah, that's a good point. Last question. In which clinical scenario do you prefer Rodin soft Reline over other chairside material?
So I like it for any conventional or 3D printed denture at this point. The only ones that we're probably not using it for, is if the patient truly needs a hard reline. And we don't, we've been using chairside hard relines for a long time. For temporary use mainly, our preference is to send the denture to a lab to get a proper hard reline. Okay. But this works great as a soft reline material for those patients who, need that extra hold right away. Yeah. And especially, again, like I said, for patients who have who are doing immediate dentures for. Yeah,
yeah, that's great. I think it's almost time, or let me.
Okay, so it's been about 6 minutes actually. In the mouth, it sets faster. It should set in 5 minutes, but it's probably a good idea to wait 5 or 6 minutes. And now we can take this off. I'm just going to pry this off. It's a little bit harder to take off on the stone. Of course, in the mouth with the soft tissue, it'll be easier to remove. And there's the reline completed. And now we can go ahead with the trimming of the material. So you want to get yourself a sharp blade and just trim up the edges, go around the edges. Of course, being careful not to cut yourself. A sharp new blade is better for this. And I find that having little scissors or nippers actually is helpful as well. We can take off the excess here with that. Just trim up the excess. And to finalize, we can use our polishing brush and also our green wheel to finish up trimming and polishing. Let's go around the edges with that. Gives it a nice finish as well. And that's it. So as you can see, it's a pretty straightforward process. Not too much work involved. And this should give you a very long-lasting, nice soft reline that will be comfortable for your patient, again, especially for your immediate denture cases.